If we can get to victims earlier, we have a much better chance of saving a person's life.
We need to know the location of that incident. We need to know the magnitude of that incident.
Okay, how many people were inside the car when you?
Time can make all the difference in the world. It can be the difference between life and death.
The sooner we get to the incident, the sooner we can control it.
Put some oxygen on you. Put a tourniquet on your arm.
We've got a limited window to make a difference.
To be effective during an emergency, responders need the information they need when they need it. This means utilizing modern information technology for easy, rapid access to essential data. Data that can be shared and enhanced throughout the response continuum, creating an environment of informed emergency response. Emergency responders are the critical links in the chain of survival. Unfortunately, a wealth of information that would help responders perform their duties far better is beyond their reach. More and better information empowers responders to perform at new levels. This information exists, but it resides on the opposite side of a technological divide. The Emergency Communication Center of the future will bridge this gap, allowing them to access and share critical information that just may save your life. The current 911 system exists primarily to receive incoming telephone calls and dispatch traditional first responders. Critical victim and incident information often exists in electronic form, but 911 dispatchers don't have access to it.
We have the technology, we just need to connect the dots.
A car crash resulting in severe brain injury demonstrates the information that is available today electronically, but not available automatically or on demand to dispatchers. This information includes exact incident location, crash data, vehicle make and model, ambulance and paramedic availability, hospital bed and medical staff availability, status of air transport services, vehicle extrication information, injury prediction tools, personal health records, hospital records, and traffic advisories.
Right now, we're having to have an individual, a dispatch officer, calling people in sequential fashion, trying to get a hold of the people they need, and that's time.
PSAPs will become emergency communication centers, assuming a vital, ongoing role in emergency response. Processing a diverse wealth of information, the PSAP of tomorrow will synthesize information from sources ranging from text messages and photographs captured by cell phones to patient histories obtained from electronic health records, to telematics crash data, to injury predictions and care records.
We need a 411 for 911. Everyone that needs to respond to an incident can see what it is, where it is, and what kind of response needs to be given to it.
Let us paint a vision of that future. After driving all day, a woman falls asleep at the wheel. She hits the windshield with enough force to lose consciousness. Upon impact, the car's telematics system immediately transmits over a commercial wireless network a voice call, exact location, and detailed crash information.
Currently, we have to call on the radio and wait for a dispatcher to come back with that information.
Crash location, deceleration rate, direction of force, airbag deployment, vehicle make and model, and other relevant data are automatically assembled at the telematics call center. The voice call goes to the ECC 911 center, along with this package of information. The data is also immediately delivered to other agencies that have registered to receive it, such as EMS, Air Transport, the Transportation Department, the police, and the closest trauma center. The crash data is then automatically fed into a new Emergency Medical Dispatch, EMD, protocol within the 911 CAD system. Now, EMD combines real data with the answers to questions, and it uses the urgency algorithm to combine engineering data with observational information to predict the probability of serious injury. The initial injury prediction, based only on the crash data, is not too severe. An ambulance is dispatched, and the EMTs review the injury predictions on the way to the scene. At the same time, the 911 telecommunicator receives the name of the owner of the vehicle from the telematics service provider. She gains access to the driver's personal health records, to which the owner granted advance permission. She is alerted that the patient is currently taking the blood thinner Coumadin. In this case, when adjusted for the driver's age, gender, consciousness, and Coumadin use, the dispatcher sees that the urgency algorithm is predicting a high probability of brain injury. Within a few minutes, we now have a very different kind of emergency. Life-saving information in hand, the telecommunicator calls for an emergency air medical transport crew to be activated to airlift the passenger to a trauma center due to the probability of brain injury. Brain trauma protocols are downloaded to both the ambulance and air responders, along with instructions to check for internal bleeding due to the blood thinner. The brain trauma team at the center is alerted. Simultaneously, fire responders now know the make and model of the car. The crash data predicts extraction equipment will be required, so they grab the jaws of life. En route, they access detailed vehicle structure data via the Vehicle Rescue Database and familiarize themselves with hazards in the car, such as electrical currents and airbag mechanisms. They are ready to start cutting as soon as they arrive. Fire responders rapidly extricate the victim. The EMTs stabilize her. The air medical team arrives and airlifts the passenger to the emergency department with the specialized brain trauma team. At the same time, the crash victim's emergency response electronic health record is expanded with voice-to-text entries from responders and automatic entries from devices such as blood pressure and pulse ox monitors. All relevant patient data is sent electronically to the waiting hospital staff. The operating room is being prepared. This information is fed into the hospital's patient system before the patient arrives, saving the hospital time and expense. Because incident and patient data was collected from the moment the crash occurred, hospital staff is able to provide rapidly informed care. Where once emergency rooms admitted patients as blank slates, these properly equipped doctors have a wealth of important information about the patient. For example, doctors are able to access a history of changes in the driver's Glasgow Coma Scale score since the first call to 911. These trend lines indicate the need for a fast operation to relieve bleeding in the brain. These significant changes in consciousness are being quickly detected.
With a trauma case, time can make all the difference in the world. It can be the difference between life and death.
Because of the responders, their skills, and the new information they have, the victim receives rapid and informed response. She survives with no long-term brain damage. The system worked not just in this crash. It got smarter and better prepared for the next emergency. Throughout this scenario, external information sources such as telematics, personal health records, and the vehicle rescue website, as well as the actions of responders, contribute data at various points along the continuum of response. Data does not remain in one place. It flows through the chain of response from 911 to EMS to hospital-based care, improving emergency care at each of these points. Ultimately, this information is used to improve response processes through protocol development and research, saving lives along the way.
This project is about getting better information to the right people quickly.
Whether the response is to pandemic flu, hurricanes, heart emergencies, or terrorist attacks, critical information needs to easily flow through the continuum of response, allowing responders to provide prompt, high-quality, life-saving emergency care. The question is not if an emergency will happen on your watch, it's when, and how will you handle it? Will you have modern data and voice communications, or will you only be able to make telephone calls? Information and evidence-based decisions represent the next generation of emergency response. Get ready to be informed.